episode of Progress, Potential, and Possibilities, discussions with fascinating people designing a better tomorrow for all of us. I'm your host, Ira Pastor.
And welcome everybody again to another episode of our show with another fascinating guest who is truly helping to create a better tomorrow. We are quite honored today to be joined by Ambassador Dr. Fernando Llorca Castro, the Costa Rican ambassador to the United States of America, who achieved that position in 2018. Ambassador Dr. Llorca has many years of experience in international development. He has held prominent positions in transnational organizations as a health policy advisor, a medical manager, a research manager, a primary care medical practitioner who still has license to practice in Costa Rica, Spain, and the United Kingdom. In 2014, Ambassador Dr. Llorca was appointed by then President Luis Guillermo Solís Rivera as the Deputy Minister of Health. Subsequently, he became the Minister and Steward of the Health, Nutrition, and Sports sector in Costa Rica, where he established private and public safety regulations and best practices policies. He also served as the role as the Executive President of the Costa Rican Social Security Fund, which is the most important healthcare provider in the country, which formulates and executes health programs that are both preventative and therapeutic in nature. In addition to his medical degree, Ambassador Dr. Llorca holds advanced studies diploma in political economics from the University Complutense de Madrid, Masters of Science in Health Policy, Planning and Finance from the London School of Economics and Political Science, and the School of Hygiene and Tropical Medicine. Ambassador Dr. Llorca also holds 2 master's degrees in healthcare management, as well as in health economics and pharmacoeconomics from University Pompeu Fabra in Barcelona. Ambassador, thank you for taking the time to come on the show today. Very much appreciated.
Well, thank you, Ira. It's a pleasure to be with you and to share with the people that are going to listen to us. And well, Happy New Year to all of you.
Same to you. Same to you. It's good to see you again. I'd like to start off, as we did with our conversation last time, just for some of our viewers, if you could take a few minutes just to introduce yourself, a little bit about your background, your sort of path through health and medicine, and a little bit of your journey to the public sector and involvement in politics, and ultimately your arrival as the ambassador of Costa Rica to the United States. I think that'll be a great way to start off and introduce you to everybody.
Thank you, Ira. Yes, well, I actually decided to study medicine because I believe I love it since I was a kid. My father was a medical practitioner, a general medical practitioner, and he used to work for the social security system, which is the public healthcare provider in Costa Rica, the most important. So obviously he was a great example for me, but at the same time, my mother, who is actually a lawyer, always told me how important is the human rights and all the way the human rights are reflected on public policies, and how the way a country is developed has a lot to do with the way of the governments, of the way the governments implemented human rights concepts and policies in the country, and trying to affect the population. So I was also very, very interested in politics, from the academic side, but at the same time, politics was something, a common topic in our lunch and dinner table back in Costa Rica at home, to be honest. So, well, I became a medical practitioner, but at the same time, I realized during my, what we call in Costa Rica, the social service, which is like the very last year after you finish the career, you have to serve in some small town in Costa Rica, trying to provide healthcare to the population, usually population that doesn't really got the access as we have it in big cities or big towns in the rest of the country. So during that year, I decided to study public health affairs as the field that I was going to develop as a career for me. So I began to study healthcare administration in Costa Rica, but suddenly, I always say it like this: I got married, and we planned it with Evelyn Cermeño, my wife, and we planned to move to study outside the country. And we had an opportunity because of my father family background to go to Spain, and we both study there. In my case, health economics was the first degree I got in Spain. I also study healthcare administration, again, in a global perspective or point of view. And after that, I was able to study also economics or public economics in la Universidad Complutense de Madrid. And well, it was not only studying in Spain, I was also able to practice medicine. I registered as a medical practitioner there in Madrid, and I practice there, but I also work as a medical manager for insurance companies, but that's the private sector, which is a point of view, a very important point of view that will teach you a lot about how the private and the public interests are at the end linked. And after that, well, back then, our daughter Paula was born in Madrid, but we suddenly moved to London because we wanted to study at the London School of Economics. And we both did. My wife first, she studied social policy, and I was working as a medical practitioner, registered at the General Medical Council in the UK, and with full license to practice. And it was an amazing experience too. I work as a disability analyst and a health analyst, trying to recognize some health risks for people or for families that were actually claiming some benefit from the government. So it was like it was linked to the public healthcare sector. And well, then I was able to study health policy planning and financing, a very important master, a joint master program between the London School of Economics and the London School of Hygiene and Tropical Medicine, both from the University of London. And well, when we lived there for about 4 years, and then Xavier joined us, the family, my second son, and we finally received the good news to go back to Costa Rica and to serve first as a vice minister of health, working with La Doctora Lopez, who was the minister of health back then, and under the administration of President Luis Guillermo Solís. And suddenly I became the Minister of Health because there was a lot of political changes and well, back then we had to face huge changes that our healthcare system need, like for example, paying a lot of attention to the way we finance those healthcare systems, and especially the one in Costa Rica, but at the same time, the way we register health events, like for example, some pathologies, and we try to introduce some standards and best practices on the way we register these events, which is something very important, and now has been show up as something that we should change all around the world during this pandemic of COVID-19, I have to say, and we can mention something about that.
Sure.
During this conversation, but at the same time, Costa Rica was on the process to become a member of the OECD organization, and the government choose the health sector as one of the first and most important ones to be accepted, and we were able to do it almost in 2016. So it was one of the first sectors that was officially approved by the technical committee involved. Anyway, at the same time, and that has a lot to do and very linked with these best practices and of governance, but also registration standards that we were trying to improve in Costa Rica. And well, because of another political crisis, I had to leave my position in the Ministry of Health, and I become the head of the Costa Rican Social Security Fund, which is the most important healthcare provider in Costa Rica, but also in the region in terms of the budget.
Sure.
And in terms of the amount of hospitals and clinics that we had to run. But I become very close to the President Carlos Alvarado Quesada as part of the government of President Luis Guillermo Solís Rivera, and when he won the election, he decided to appoint me to this very important position for the Costa Rica as a country, because of being the ambassador to the United States. But it's very important because the United States is still the best partner we have in the world in terms of trade, in terms of the amount of tourists that visit us from the United States, and in terms of the investors that actually move from the United States to Costa Rica to do so, and all at the same time working together against some regional problems like drug trafficking, for example, migration, illegal migration, and human trafficking. And at the same time, a lack of of uh, or trying to promote best practices in democracy affairs and some other related, like uh, the importance to recognize human rights as something that we should in not only in some specific countries, in a whole region, for example. So it has been a long way, but so far a great one. Yeah.
Excellent. Excellent. I appreciate that background. It's a very exciting journey so far, and sure a lot more to come. You know, when we had the opportunity to talk about a year ago, a lot has happened in that year. Some good, some not so good. I think I'd like to start off with some of the good. There was a few months ago, a very interesting announcement by President Alvarado Quesada, along with your Minister of Science, Technology, and Telecommunications, Dr. Vega Castillo, announcing Costa Rica's new bioeconomy strategy, where it was announced the development of this new strategy based on decarbonization, green, resilient, and something very interesting we talked a little bit in the past about circular. So no waste, ultimately using everything. It's a fascinating initiative, and it's supposed to become one of the cornerstones of the country and its future development. Can you talk a little bit about this initiative?
Yes, definitely. We recognize that in Costa Rica we've been developing this strong health sector, not only because we were able to have this public healthcare provider institution that's actually it's well recognized as able to provide universal coverage according to the World Health Organization and PAHO also in the region, and well, all the institutions and the resources you need to support that ongoing in a long term, as we have done it, and we were able to train doctors in Costa Rica, to train specialists, to develop some other healthcare professionals. And it's true that because of this and link to this state policy, let's call it, or national policy, to be open for these foreign investors that wanted to invest in Costa Rica, a lot of them in high-tech, health, high-tech companies that invest in this production or manufacturing these medical devices, for example, or even some pharma techno products. We definitely found that there was a big opportunity to also bring not only the production or the manufacturing process of the products, but also to bring the design and how to develop or to improve those products in Costa Rica, because of the healthcare we have, because of the human talent we have. Definitely there was an opportunity to bring research projects to the country and to contribute, as I said, not only to develop the products, but also to the way those products are designed. And actually, the government and some private sectors, because this is a real private-public partnership relationship. We are putting all the things together to do so and to continue contributing to these biotech research improvements that we need. Because of the pandemic, we were able to identify huge manufacturing chain problems on the way we produce the goods that we need in healthcare.
Sure.
Ventilators, you name it, were a huge problem during and because Costa Rica is very close to the United States, and we are still a place where we have the same time. There's a lot of flights, very well connected, and by sea is not that far. We recently improved our ports, mainly the port of the Caribbean port, and because of these logistic advantages, at the same time, we believe that we should continue working on developing these kind of products, but at the same time increasing the amount of manufacturing and production of those. So it becomes something official because it has the support from the government and Minister Vega, the Minister of Science, Technology and Telecommunications sector, but we also recognize that our society should become a completely bilingual society, and that's something else that we wanted to add as another piece of the puzzle that we are trying to figure it out and to see how we take advantage of that. We recognize some challenges we've been able to develop some research activities in the country, mainly in health. Since 50 years ago, we've been developing these anti-venom solutions to treat snake bites in Costa Rica, and all of these have been developed in Costa Rica in terms of the research project, the clinical trials and everything. And at the same time, in joint ventures with National Institute of Cancer here, the NIH, and some other agencies. For example, we've been able to develop some vaccines, like the one that he wants to fight against papilloma virus, for example, very linked with this cervix cancer problem. A lot of women still are at risk, I'm afraid. But we want to do this as something more common, more accessible for some other private and public institutions in the United States and all around the world. But we recognize that the United States is still again, our best partner and the closest, and we know that a lot of companies, big names of the biotech sector already recognize the advantages of being there in Costa Rica. So that's what we are actually talking about.
Excellent, excellent. Moving to the theme of the pandemic and COVID, Costa Rica has been in the news a lot on this front as well, on both internal. So there was I saw an article recently about the Costa Rican Social Security Fund, which you were the president of, and a very ambitious schedule for vaccinating the entire population within the next 10 months. Also, on sort of the foreign front, President Alvarado Quesada was in this joint announcement with the director of the WHO, and I think also the president of Chile, on sort of the solidarity program with other members of the WHO, such that for obviously this pandemic, but God forbid, whatever comes next, that there needs to be a better system for equitable access to whatever these things are: masks, ventilators, new drugs, vaccines, and so forth. Talk a little bit about Costa Rica's leadership in both what you're doing at home on the vaccination front, but also through the WHO.
Well, yes. First of all, we have to recognize that the pandemic has been affecting us all, at least in the Western Hemisphere, in a very, very special way. No one has been able to maybe some specific islands that were lucky to shut down very quick, but at the end, as soon as they open, because of our culture and human behavior characteristics, is something that we realize in the whole Western hemisphere. The pandemic and the way the virus spread, it's something that we've been affected. Costa Rica is not an exception, and our president Carlos Alvarado realized that very soon. But at the same time, we knew that this kind of pandemics, the best way to fight them is with science, with evidence, with technology that has to be developed by someone. And yes, we recognize that the private sector is usually, or has been usually, the best and the quicker sector to provide solutions. But those solutions should be accessible for most of the population, and that's why our president and the Ministry of Health become very close to the General Director Tedros in the World Health Organization, and trying to develop some strategy to provide the option to private public initiatives to share some of these technologies to be applied or implemented all around the world. At the end, there was a lot of initiatives locally in many countries. For example, you were able to see small businesses manufacturing their own masks in 3D printing process, sometimes even at home. And well, our universities in Costa Rica developed some ventilators and some tests options. But you know, one of these problems is not to develop these products, it's to produce the products.
Right.
And we realize that this huge, massive production, it's already developed in some countries, and well, we realize that at the same time, La Caja Costarricense del Seguro Social, the Social Security Fund, it's always a great buyer and even internationally of these kind of products, and yes, we contact most of the private companies that were developing the vaccine, and we have already some contracts with them, trying to cover at least 3 million people of our 5 million population. We don't believe in public health affairs that everyone should get the vaccine, but as something mandatory from the government, it's that you should cover at least most of the population on risk. For example, healthcare providers, you know, first line or first respond professionals, vulnerable people, old people, chronic disease, people with chronic disease, and of course some specific professions, you know, the face-to-face workers that are actually on risk because of this. But we started with trying to cover at least 3 million from the 5 million people, and that's something that has been arranged. And of course, we are now on the process to apply the vaccine. We started the 24th of December.
Okay.
That's yes. But despite we have a strong healthcare system able to reach most of the local communities in Costa Rica very fast, it's going to take a while. It's going to take a while, and you can see that kind of challenges everywhere. Yeah. There is no one able to apply the vaccine you will maybe the countries that maybe if they get involved, the military, the army or something like that, but we don't have an army since more than 73 years ago. So our army are the healthcare providers, and that's what we are, and that's how we are facing this challenge.
Sure.
Of course, there has been a lot of critics on the news about it, the amount of shots of vaccine we got, the way it has been applied, and the timing process. But to be honest, Costa Rica has been doing very well trying to apply this vaccine, and we have several contracts with most of the companies available, which is also good in terms of trying to diversify the risk of just having one contract, you know.
Yep.
It's not the first time during this pandemic, we've been facing production and the products we already contract or buy being really supplied to the people and the places where really needs and we don't want it to happen that with a vaccine and we try to have contracts with all the companies and that's something maybe that will make the process a little bit lower, but not that fast. But at the end, we offer the guarantee to our population that they will receive the vaccine the best way possible from our point of view. So I don't know if I really answer your question.
Yeah, it's, I mean, the principles of best practices and what you're learning. I mean, obviously every country is different, but you know, it's you know, when you see an ambitious schedule like that, there's things to learn about it, and so I think that's important. And yes, you definitely answered where I was going with that. You know, one other thing that we had the opportunity to talk about last time when we spoke was, you know, the importance in the Costa Rican economy of both, well, tourism, of course, but medical tourism, ecotourism, very, you know, these are two important pillars that you have built in Costa Rica. Obviously, you know, the world's been locked down, but any interesting findings as you've been opening up, any plans for, as the world opens up again, these two industries in particular, and sort of reestablishing your leadership in them?
Mm-hmm. Well, because we've been developing the tourism as one of the most important activities for our economy. Again, it's a national state policy. This has been going on for decades so far. And we already found that there's a lot of foreigners that comes to Costa Rica to be treated, from dental pathologies, trying to reach some specific dental procedure, implants or aesthetic at the same time procedures. But they have been also being treated of medical pathologies in general, some specific surgery, trying to reach some specific wellness treatment that they want. It could be mental health support, etc. We want that to become something more systematic, more official, with the support of the government, and we want that to become something also standardized, because when you have a situation like the Costa Rican used to have a couple of years ago, where everyone is going their own way, they establish their own prices, policies, they don't offer standardized quality services, and we want to put that in order and to officialize that in a better way, and try to take care of the name of the country, Costa Rica, as a brand. You know what I mean? If you have a couple of doctors taking advantage from tourism, trying to charge them huge amounts of money, not taking care of the quality of the services as a priority, and there's a lot of, I mean, that word quality service includes a lot of things. The follow-up, to really make sure that the procedure and the people is really fine and recovering properly. And well, you're putting the name of the country on risk.
Yep.
So we want to take care of that, to introduce some standards, to officialize some pricing policies, reasonable, and we also want to seduce some insurance companies, some companies with huge amount of partners to be covered and to offer them great, nice price and high quality options for their health problems, and that's what we are doing. But of course, yes, the pandemic wasn't the best partnered on this. Actually, we were receiving more than 3.5 million tourists before the pandemic per year in Costa Rica. Most of them coming from the United States, almost 2 million. And we wanted to increase that amount, but the pandemic has been a huge problem on that. So we need to recover the country from the pandemic to offer a nice, secure, and we would love to offer a free COVID country to our visitors in the future. And of course, we are working on that because we know that as soon we get there, the rest of the economy will recover as a consequence. That's something very important, Ira.
Absolutely, absolutely. Ambassador, Doctor, are there any other important things that you'd like to mention about Costa Rica? Anything upcoming, anything that I've missed that you might want to take some time as we wrap up the show to tell the audience about?
Yes, thank you. Of course, Costa Rica has been developing this, again, national state policy of taking care of environmental affairs. And that's linked to our ecotourism policies of bringing people to enjoy and to know and learn about that environmental policies we have. And of course, our government has been trying to push in that direction, taking advantage from these energy sources coming from renewable sources that we have. Almost 10%, 100% of our energy, talking about 98% every year, has been produced from renewable sources. Most of them hydroelectric plants or wind production or eolic production of energy, but at the same time, geothermic. At least 10% of our energy is coming from these geothermic sources, because Costa Rica is a land of volcanoes, and we took advantage from that. And all of this is linked to these efforts of trying to reduce the amount of carbon emissions we still have and dealing with, mainly linked with the transport. We have to recognize, and we are trying to introduce electric trains in the country, electric cars, and some other cleaner options of transport in Costa Rica. And that is something at the end also linked with these biotech research opportunities we want to offer to the investors, because there is a very clear link between a lot of respiratory problems we've been facing with this contamination we've been dealing with, I'm afraid, all around the world. But there's a lot of work to do, and Costa Rica has the commitment to do it, to improve, to get there, and to become, if we can, a great example to follow, at least for the neighbors or some other countries that really want to know if that change is possible. I used to work for more than 12 years, in Europe. And when you bring examples, success examples in any field to the developing countries, the first thing they are going to say is that those countries are rich, those countries are powerful. It's always very important for developing countries to have good examples, real examples from some other developing countries, because the most important step we have to give is to have the will and to organize our legislation, our politics, and to realize the way we face those problems, that the solution is really, really in our hands.
Excellent message. Excellent message. It's been an honor talking to you again, and really wishing Costa Rica the best with everything as we come through this pandemic and start up the world again. But thanking you for your time and your leadership on these fronts, and for sharing everything that's going on, and as best practices, so we can all learn from one another on many fronts. For everybody listening to this episode on the podcast or watching, we've been speaking to Ambassador Dr. Fernando Llorca Castro, Costa Rica's ambassador to the United States. Ambassador Dr. Llorca, it's a pleasure seeing you again. Thanking you for taking the time out of your schedule for talking to us. And as we say on the show, thank you for helping to create a better tomorrow via everything you're doing. Thank you really once again. It was a great time.
It has been a pleasure. We really thank all the people that has been listening to us, and I really appreciate your invitation, your work. Congratulations for a great work, and well, Happy New Year too.
Same to you, and hopefully I'll get down to Costa Rica when this is all over. It's probably nicer there than cold Philadelphia.
You will, and it will be a pleasure and an honor to have you there.
It would be great to see you.
Bye-bye.